can you please address our viewers?
Thank you very much. This is not my usual voice. I do have a bit of laryngitis, but I can still talk. Let me start from where you started by saying vaccines have always been there. Any parent who gets discharged today or yesterday, anytime after giving birth to a child in a clinical hospital, you'll be given, and in fact, it's your right to have a BCG vaccination given to your child because this child has been in a very warm and friendly environment in the mother. Suddenly, the child is out into this environment where there are many diseases, and we now have taken a decision that we have TB in South Africa that is going to stay with us for as long as we live. So therefore, any newcomer into this world, a baby, must be protected against TB. And the mother will also be given a card we call a road to health chart, saying to this mother, at 4 months, at 8 months, come back again for the vaccination of measles, polio, rubella, and all sorts of other, so that you keep on protecting this baby against these diseases. So immunizations or vaccination is not something new. It's always been there. There are South Africans and people in the world who have other illnesses, people who have had their spleens removed, people who are just generally weak, the elderly. When there's winter setting in, we advise them to take a flu vaccine of that current flu that is going to be announced that particular year or season. Again, meaning that vaccination is not something new. The only thing that is new is that we are asking for everybody to be vaccinated, because all of us, by October 2019, our bodies did not have any protection against COVID-19 because there was no COVID-19. Suddenly there's COVID-19 in the world, and our bodies are like the newcomers into the world because we are now confronted by this new virus. So that is the principle of really requesting all South Africans to be vaccinated. Let me then finish by saying, to date, as of yesterday, we have used 23,900 vaccines. So it's just over 25,000 vaccinations that have been done in the country. Of that, more than 16 million people have been vaccinated with at least one dose. And there's 13 million South Africans, in fact, 13,940,000 who have been fully vaccinated, meaning they have got either one dose of J&J or 2 doses of Pfizer. And we noticed this, that is very important, because you were right. We're really pleading that maybe by end of this year, we should have vaccinated almost 40 million of our South Africans, which will really be a good figure to protect them against the immunity, against the disease. I might as well say we still wish that we can be supported on this call for vaccination because we are noticing, especially where we are in this province, Gauteng, numbers are beginning to come up in terms of testing for COVID. And we are not at the level where we were 2 weeks ago. So we might just be experiencing a 4th wave. We are therefore pleading that if we could push as many people to be vaccinated, the best. The government is not planning as yet to make vaccinations mandatory, but it will be mandatory from that company, from that factory. But there are incentives that if you are vaccinated, you probably will get better access to that restaurant, to that stadium, to that museum for this and that. But that is not a government policy to vaccinate, and there's no plan to vaccinate people mandatory for now. Thank you. Let me then maybe pause there for now.
Thank you. Honourable Deputy Minister. Maybe before I hand over to you, Dr. Pell, let me just say to the Deputy Minister, we know that when people are educated and given knowledge, equipped with knowledge or empowered with knowledge, they are able to make informed decisions with regard to issues concerning their lives. Maybe the question that I would ask, which I see that many people are asking, is have our government done enough to educate the people of South Africa regarding these vaccinations that are being rolled out now?
The measure of the success of the campaign will not be measured by how much government has done. This is bigger than the government, but the government has made communication available to our traditional healers, traditional leaders, faith-based leadership, all community civil society leaders, universities, and all people in the walks of life. The media has been very supportive. You might actually notice that a rural province like Limpopo is the one that actually has had more than 65% already of the elderly people vaccinated. Why? Because there are two leaders in that community leading very big churches, the Zionist Church. Both Bishop Balabas have gone to vaccinate publicly, and therefore their followers have since followed. There are people in this world who would believe more on their traditional leaders, who will believe more on their pastors and their leaders in the mosque or in the temples, much more than they would believe on a politician. But what we have done as government is to actually distribute that information made available. Like you would notice, the minister does not only have a ministerial advisory committee that is of scientists, but there's another ministerial advisory committee of civil society where all these leaders I've mentioned, traditional leaders, traditional healers, faith-based leaders are all in there sharing information and distributing it and taking it to their constituencies.
Thank you. Thank you very much, Honorable Deputy Minister. Thank you for the inputs. And it is true, this is not a one-man's job. The educating part, people need to be empowered with knowledge. Dr. Kupe, you have been writing quite a lot about this. You have been talking a lot about vaccinations. You have heard what the Deputy Minister has just said. What is your input?
Yes, thank you. And thank you also to our Deputy Minister for his opening and initial comments. Raleboha. Just a few comments I would like to make from the beginning. First of all, my approach and my input will be really mostly from a legal perspective. I'm an attorney, and I have quite a few concerns around an approach that any nation they take where they make vaccinations mandatory on any people. I'm concerned, of course, from the constitutional perspective, because constitutionally we are guaranteed a freedom of choice. It's one of the very important provisions that are there in any constitution. And of course, if we're looking at the South African Constitution, we're talking about Section 10 of the Constitution, which protects our freedom of choice. And it says that everyone has a right to make their own decisions. That's freedom of choice. And it's part of giving people dignity. Freedom of choice and dignity are inseparable. So to deny people right to choose is to deny them their dignity. I want to say that from the onset. I also want to say our Honourable Deputy Minister did mention, the aspect of vaccines. It is true, we've had vaccines around for quite some time. And yes, they've been around. But there's something very unique about the COVID vaccine. And I'd like to point those out. As far as I know, most vaccines have to undergo a certain process in terms of their approval. And I would wonder, as far as I know, the COVID-19 vaccine, which within a short space of time, in less than a year, actually was being administered on people. As far as I know, it's actually not been formally approved, but it's what is called clinical trial. And I hope maybe the Deputy Minister will actually make some comments on that, because in my knowledge, these vaccines are still actually clinical trial. And I think if that is so, if that is the case, WHO and all the Ministry of Health need to openly and transparently come out and tell people that actually this COVID-19 vaccine has not undergone the normal procedure of approval. And people should know that the vaccine has been administered on a clinical trial basis, so that people know that in essence, actually, to some degree, we are guinea pigs, because that's what clinical trial means. It means that there's not been really any formal approval. So I hope the Deputy Minister, will address the issue of whether these COVID-19 vaccines are still on on clinical trial, or whether they have been formally approved as per all, the normal process that is required internationally in terms of the international process. The other thing that the Deputy Minister also mentioned, he said, these are normal vaccines, there's nothing different. But I would say, he talked about the flu vaccine. He referenced the flu vaccine. And I would say that one thing about the flu vaccine, and as far as we know, Mamuruti Pasumukuba, is that this is also a type of flu vaccine. It's a mutation of the SARS flu, and it's one of the cousins of the SARS, and SARS, we know, is a type of flu. But nowhere in the previous past has anybody ever been forced to take a flu vaccination. It's never been mandatory. It's been by choice. So what is different about this different type of flu, which the government has openly said, actually, even when you get it, you have more than a 92% chance of survival? Ordinary flu kills more people on a normal annual base. Ordinary flu kills, if you look at the statistics and compare them, ordinary flu kills more people than have died through COVID-19. That is a fact statistically. Also TB, number of people who die from TB and HIV are more than the number of people who die from COVID-19. When we have somebody suffering from TB, we don't do lockdown. In fact, the person who suffers from TB is the one who's isolated. We don't isolate a whole nation. So I think those are some things that we need to look at. The vaccines, are they on trial phase? And then the other thing that I think took me aback, a little bit of surprise, around the Deputy Minister saying they're not mandatory. I was a bit surprised because recently South Africa played a big soccer game against, I believe it was against Ethiopia, and the Minister of Sports said that you will not be allowed in. There's no entry unless you're vaccinated. So I would like to ask from the minister, if that is not mandatory vaccination, if that is not making vaccination mandatory, then what is? And I also want to say, as a nation, we're getting confused, because the Minister of Sports is saying you cannot come into this game unless you're vaccinated. But then the Minister of Health is giving a different message. So we would like to ask the government, really, can we be consistent in giving our messages? And if it's not mandatory, then perhaps the Minister of Sports needs to be informed. With all due respect and with all the graciousness, I'm not being rude, but I'm saying government needs to give one consistent message. So if the government is saying, as a policy, vaccinations are not mandatory, let that message be loud, be clear, be consistent, so that all the ministers, all the representatives give the same message, and they're not requiring people to be vaccinated in a mandatory way. Let that message be clear, so that employers do not give workers. Right now we have a situation where employers feel that government is saying that they have the right to chase people out if they've not been vaccinated. So if it's not mandatory, like the Deputy Minister has just informed us right now, and I'm very happy to hear that, you know, I'm rejoicing. If it's not mandatory, at least we have it on record now, that it's not mandatory, which means any person who's making it mandatory actually and is coming from government is operating and functioning against the government policy. So any organization that is actually forcing their workers to vaccinate against their constitutional freedom of choice, against their constitutional right to practice their religion, against any of those, you know, against their own desires, then they're operating against the government policy, because we've just heard from government that it's actually not mandatory. And if that's the case, then we applaud government. But I hope that is truly the case.
Thank you very much, Dr. Kupe. We are now having different messages. We are hearing different messages from different people. It's just a pity that is happening at a time where people are very, very confused. People are confused, and there is a lot of misinformation. There is a lot that is going on. And now people don't know what to do. Hence, we are having this session, so that people can be able to listen and hear for themselves and be able to make informed decisions. Because one time you're going to hear somebody saying that vaccinations are not going to be made mandatory, and the other minute you are hearing somebody saying that you're not going to be allowed to come to our university if you're not vaccinated, or you're not going to be allowed to work in this company as from January next year if you're not vaccinated. So people are very, very confused, and unfortunately it's happening at a very, very bad time, a time where people are dealing with quite a lot, because I mean during this time of COVID-19 people are dealing with quite a lot of stresses. And Deputy Minister, before I go to Dr. Kathrada, was just wondering if you would want to say something regarding what Dr. Kupe raised. Because she's saying that there is this thing that vaccinations are said not to be mandatory by government, but on the other hand, like the example that was cited of the Minister of Sports, it sends a different message.
Let me start. 23 million South Africans have vaccinated. So they are not confused. They are not. We're not really talking about figures that we are still trying to pick up. They are vaccinated. Number two, the opening issue of saying mandatory, I mentioned it, but now it comes up again from Dr. Kupe as if I did say mandatory. It is not. The quotation of Section 10 probably should not have been part of the discussion, because that part I'm not disputing. That is why the government is saying there's no mandatory vaccination. Now, I'll come to the issue she's raising about the Minister of Health, Minister of Sport. I will actually say there was a clinical trial. In fact, last week, I was with the professors in talking about the issue of vaccines. And to date, we don't have a vaccine as yet against HIV. And yet HIV has devastated so much. Someone was saying a few months back, do we think we're going to have a vaccine against COVID-19? Some said, no ways. There's still a long way to go. We don't have a vaccine against HIV. And little did we know that the clinical trials have taken place. There were clinical trials not in South Africa, all over the world. And here it was led by a team of professors, Glenda Gray of Sisonke. They did clinical trials, and the results of the clinical trials came in support of this vaccination program against COVID, who was a Johnson & Johnson vaccine manufacturer. Now, I don't know, Dr. Kupe, whether you are aware, we have a very reputable organization in the country which is independent of government, SABRA. South African Health Products Regulatory Authority. It regulates. It does not register anything. That they are very rigorous in their. So you go to talk to them if you have an issue about why did you start this vaccine, because they approved it. So you are saying in your knowledge it is not approved as it is. It's approved by a very reputable organization in the world called SAPRA. Now, I didn't understand what was the issue about flu vaccine, what you were raising, that you are saying is not mandatory. We are saying South Africans, those who are elderly and those who have probably have got splenectomies, spleen removed, generally with weak immunity, they are always advised to get vaccinations against flu in any year when someone has come up and is a scientist and said, the common flu that we have in the world is this one called whatever name. And you don't pick up a common flu in Soweto. It's a common flu that starts in countries where they already begin to have winter before us. And therefore, there's a statement that says, if we have this in Russia, in China this winter, the most likelihood is that this is going to be a dominant flu in the world, and therefore we advise people in the world to vaccinate against this. With an advice, you can take it or leave it. Now, I don't know why you are failing to separate these two. When in my house, I say I'm not going to invite you if you are not vaccinated. That's not the government. I can discriminate against you if I wish. It's in my workspace, it's in my territory. If a particular company says, I want all my workers at work, I don't want them to be down on flu, on COVID, and therefore I'll make sure I want to say to them, all of you will be vaccinated. Because if I vaccinate 10 and I leave 4, those 4 will come with the flu and will also not only be absent from work, but will affect my other workers that are supposed to be doing production. That's my call in my own house, in my own space, in my own workplace. And there's no government that is going to actually come and tell me I must not do that and enforce it in my own house. If you visit me in my house and you are not vaccinated, I will not invite you to my dinner table. That's my choice. So please separate that from the call of government to say we shall not push people to be vaccinated, but we shall not, actually, you can take them to court if you so wish, but we shall not stop any private household, private companies, any other person who says do not, including people who are going into, it's happening in the world, the whole world. You don't get into Moses Mabhida Stadium until you show those there that you are vaccinated against COVID, because you might be coming into the stadium and infect them. There's the choice of SAFA, there's the choice of the Rugby Union. All of them are pushing for that line. We're not going to stop them to do that if they wish to. But that is not a government policy. But it is their policy as private companies, and if they wish to do that, then they are free to do so. Thank you.
Thank you, Honourable Deputy Minister. Let me move to Dr. Kathrada now. Dr. Kathrada, can we hear what you are doing with regard to this issue of COVID-19 vaccination, or the COVID vaccinations?
But before I tell you, I just want to clarify a few points, listening to the discussion here between the Honourable Minister and Dr. Kupe. And I want to say that I totally agree with Dr. Kupe. The vaccinations in South Africa are approved, but under emergency use access, which means that SAPRA has approved them under emergency use access, which means that they are still in a trial. So I'm the doctor that wrote the letter to the president about ivermectin, when ivermectin was banned in South Africa. And the reason for my writing to the president was to tell him that he trusted us, the medical doctors who are on the front line treating the patients who are COVID positive. He needs to trust us to give the best advice to our patients regarding treatment. And that is the second point I want to raise, because the minister spoke about information. Information that goes to the public and information that goes to the doctors are just as important when we're in the time of a pandemic. Because we were at a loss as doctors, because our government went from saying lockdown to save lives and livelihoods, and then we went straight to pushing vaccines. There was a big void, and nobody was looking at treatment to treat these people, like Dr. Kupe said very rightly, from a disease that has a very, very low mortality rate. In fact, in the age group between 12 and 17 years old, the mortality is less than 0.0001%, and yet our government is pushing to vaccinate children between the ages of 12 and 17. So when it comes to information, we need to remember what kind of information we're giving. And when it comes to informed consent, we need to be knowing both sides of the coin. Yes, it is your right to not invite somebody to your table if they are not vaccinated, but it's also my right to not get vaccinated in the first place. Because me as an individual and me as a doctor, I have done my research and I know that the risks far outweigh the benefit. And you cannot tell me that telling people that they have to enter a stadium, which is wide open space, where there is sunshine, there is circulating air, that a vaccinated person is safer than an unvaccinated person, when we know from numerous studies that a person can give and get COVID-19 just the same if they were vaccinated or unvaccinated. So by telling a vaccinated person, you need to take the vaccine to protect me, and that is why you cannot come to work, because I want you to protect the people around you. It is very, very irresponsible to make a statement like that without looking. Because like the Honourable Minister said, they have set up the Ministerial Advisory Committee. They've set up the vaccine committees. But who is on those committees? Is it us, the doctors who are on the front line treating these patients? Or is it people sitting and crunching numbers and looking at data that's coming out from around the world? I can tell you, I have treated well over 600 COVID patients in my practice, and not one of them has entered hospital. Not one of them has died. So I can tell you that if you want to know how to treat COVID-19, come and ask doctors like us on the front line. And then we get chastised when we want to do our jobs as doctors, because I'm sure Dr. Kupe will agree with me that it is my right as a doctor to treat my patient, knowing that I took an oath to treat them first, do no harm. That is the oath I took. It's the Hippocratic oath I took as a doctor. And if I have a patient in front of me telling me, Doc, must I take this vaccine because I'm high risk, or must I not? My answer right now is going to be, there is not enough evidence to show me that the benefits for this vaccine is better for you. And I am your doctor, and I need to do what's best for you. And with the knowledge that I have, I am answerable to God, and I am breaking my oath because I'm not giving you the best advice for you. He mentioned the BCG vaccine. The BCG vaccine was developed over a period of 13 years, from 1908 to 1921. It took 13 years to develop that vaccine. Yes, the BCG vaccine has been given out, but still to date, 2 million people die from TB every year. And my daughter, both of them did not take the vaccine when they were born because both of them were premature. So we had to wait, because for the best thing for them to do was not to take it when they were born. So every case is individualized. And when we mass vaccinating people in the middle of a pandemic, we are not saving lives and livelihoods. And I need for us as a people to come together, and as our government needs to trust us. We were the ones fighting on the front line. Come and ask us what is best for our patients. And when we're doing that for our patients, we need to get collaboration from the government that's also going to support us as doctors and not label us as anti-vax when we are pro-choice. Because when you're making informed consent, you've got to get both sides of the coin, and then you make the best decision for the patient that is in front of you. You cannot be making a blanket decision that everybody walking to a stadium needs to be vaccinated to protect somebody else. That is not our constitution. That is not liberty. And we are not in a pandemic of a health pandemic. Right now, we are in a pandemic fighting for our liberty. That is the problem. And we as a people need to understand that and take out of our minds, because pandemic, according to the WHO, just means that the same disease is being transmitted in several places. It does not have anything to do with mortality or morbidity. It doesn't mean that people are just dying everywhere. Pandemic just means that people are getting the same disease in different areas. That's all it means. So we need to be spreading the correct information so people can take what is right and make the decision for themselves, because it is their bodily integrity to do what is right for themselves.
Thank you very much, Dr. Dr. Kupe. I see that you are like you want to say something before I go on.
Yes,
okay,
please.
you can go on and comment because
Thank
I can
you.
see that you are bending there where you are
Thank you.
seated.
Yes, I did also want to respond to a few issues that the Deputy Minister raised in respect of what I said. One of the things he asked and said he doesn't understand the relevance of Section 10 of the Constitution. It's actually relevant and central to the discussion. The question at hand before us is, should vaccines be mandatory? And so, you know, the aspect of freedom of choice is central to this discussion. We can't have that discussion without talking about the implications of mandatory vaccines. So Section 10, as a lawyer, I know he's speaking as a medical person, I'm speaking as a lawyer, and as a lawyer, it's critical to this discussion. The Deputy Minister also wanted to know if I was familiar with SAHRA, which is the South African health regulator. I am very familiar with them from a legal perspective again, because it's the same institution, and I'm sure Dr. Kathrada will know about this case. There were two legal cases against SAHRA, because initially they had, he was talking about them as an approving institution. The same SAHRA had stopped the usage of ivermectin on the basis that ivermectin was only approved for animal usage. And because it was taken to court, the same South Africa health regulator, before the case even went to court, the South Africa health regulator capitulated before, when it was supposed to go into court. AfriForum took them to court, and they signed and agreed that actually ivermectin, as Dr. Kathrada has talked about it, ivermectin which has been used, ivermectin which is a Nobel Peace Prize winning drug, ivermectin which has been used for decades in many nations like Nigeria, which has a very low rate of COVID-19 because of their usage of ivermectin against river blindness and malaria. The most populous nation in Africa are using ivermectin. And because of a court case, SAHRA now said, okay, no, you can use ivermectin. The same SAHRA that had said you cannot. And then they said that you can use it, limited usage. Then ACDP took them to court again, the same South Africa health regulator. And this time they said, okay, now you can have access to ivermectin, but only if you source it locally. So I do know the South Africa health regulator. I know them from a legal perspective. I know that that they've lost cases in court. So in terms of approving and approval, the approval I'm talking about is international regulatory bodies, not our local regulatory body, which has actually lost cases in court on 2 occasions on the issue of ivermectin. The last issue which the Honourable Deputy Minister mentioned was around if I'm in my house, meaning a workplace, I can do what I want in my house. The problem about that, it is connected back to government again, because these employers are doing this on the basis of regulations they understand were made by the Department of Labour. So they feel licensed. It was not until the Department of Labour and Employment and Labor released regulations that employers started now issuing these mandatory policies to workers. Before that, they had not done that. So clearly they've connected it to government policy. And again, I would like to say, let us not have mixed messages. If it is not mandatory for employment, please, government, come out clearly and tell people it's not mandatory, so that organizations will not operate on the basis of what they perceive to be certain information. They're doing that because of the regulations that were issued by the Department of Employment and Labor connected to the disaster management. So they issued regulations on that. Clearly, if it's not mandatory, the employers have not understood that. And it's government's responsibility now to make sure that they understand. So, we really need, the government has to consider all of these things, the mandatory aspect, and I'm so glad Dr. Kathrada raised the aspect of efficacy of vaccines. we know that we cannot make vaccines mandatory when we know that you can still contract COVID after being vaccinated, when we know that you can still infect others even after being vaccinated. Why then should people pose themselves to a potential danger of being vaccinated if you can still contract COVID and infect others? And the reason why I'm saying potential danger is because we know statistically that some people have suffered adverse effects as a result of vaccination. I think we need to talk about that. It's possible to track. Even in South Africa, we have networks, we have websites where they track people who've been adversely affected by vaccinations. That's why we cannot make them mandatory, Muruti. And there are people who've been affected adversely and had a number of very negative health reactions. And the fact that our Dr. Nkosazana Dlamini Zuma actually established a no-fault compensation fund for people who have suffered adverse effects that you can go and claim under the no-fault compensation fund. Mamuruti, you don't start a fund to claim compensation for negative effects if people have not had negative effects. You won't start a fund like that. So the fact that government has started that fund is, in my perception, admission that yes, there are people who suffer adverse effects. So in that case, you cannot make anything mandatory. The minister, I listened to the minister's speech, Minister of Health speech, when he was talking about rolling out vaccinations to the 12 to 17 age group, like Dr. Cathrido had referred to. And one of the things that he talked about, Mamruti, he said that children will only be given one dose, one jab of the Pfizer vaccination. You know why? Do you know why he said? He said because it has been found that if they get 2 jabs, I'm quoting the minister in his speech, if they get 2 jabs, his speech is available on the government portal. If they get 2 jabs, there's a possibility that they can develop a disease called transient myocarditis. Now, I'm not a doctor, but at least I studied forensic medicine, and I'm sure Dr. Cathadra would probably be able to elaborate on transient myocarditis, which I know is an ailment of the heart. So the minister has actually said, we're not going to give you 2 jabs because there's a possibility that you can get a health ailment from that. That to me is an admission by government that these vaccines, there's a potential harm that you can suffer. Otherwise, the minister would not have said that. And so we cannot afford to make these vaccines. Will the government be willing to take on the number of civil claims that people will make for injuries? Will the government be willing to face criminal charges of deaths that may result as a result of adverse effects to the vaccine? So that's my 2 cents.
And Dr. Kupe, you are saying that people are getting affected adversely because of the vaccines. And there are people who are presenting with problems, and some of who are saying we have lost our family members after they got vaccinated. And as a result of that, it is very dangerous to make these vaccinations mandatory. Did I hear you well?
You heard me well to say if there is any risk, and I've cited 2 examples to you. I said 1, Dr. Dlamini Zuma has opened a fund for those who are adversely affected. You don't open a fund if you don't know that people have been adversely affected. So it's an admission that, yes, we know there's some who've been adversely affected. So you can claim compensation from this fund. And secondly, the minister himself, from his own mouth, you can go and get the copy. He's talked about transient myocarditis appearing in some people who got the second Pfizer jab. He said it has happened, and so we are not going to inject children with the second jab for that very reason.
The issue of children is an issue that is concerning to most parents, and we were with Professor Madi here on this show, and he's doing research. He's at Barra from VES, and then he said to the viewers that he would not advise the vaccination of children. But immediately after he said that, we saw that then the vaccination for children then started. So that is why I was saying that there is a lot of confusing messages, even though our Honourable Deputy Minister is saying that no, people are not confused because they are getting vaccinated, and we have got millions who are vaccinated. But when you listen and when you read whatever that is out there, like now I'm talking to the Honourable Deputy Minister, I'm talking to Dr. Kathrada, I'm talking to you, and we can hear that there are conflicting messages that are going out there to the ordinary person, even to the unlearned, because this is affecting everyone. It's affecting everyone. So the truth is, there are many people now who still don't know what is the right thing to do. That is why it is very important for information to be disseminated to the people so that they get this knowledge and be able to make decisions themselves. Because, I mean, you were raising the issue of our rights. I mean, people these days are saying that are we still in a democracy, or have things changed in our country? And another thing that I've noticed is that, or that I've noted, is what Dr. Kathrada was saying. I mean, she's a doctor, so when she speaks to us as ordinary people and she says that we should be involved in this, then we start asking questions. Who is advising our government if the doctors are saying, but it's like you didn't consult us, exactly what is going on? But anyway, right now I'm going to give our Honourable Deputy Minister a chance to respond to what you have raised. Deputy Minister?
Back to you now.
And I'll start from where I started. I was saying to the learned professor, to the learned lawyer, the issue of Section 10 is not relevant for this discussion because there is nobody who has actually come up with the issue of government vaccination being mandatory. It's just a lecture and a talk, which I would not really think it is relevant. That's what I was saying. At least with this, if you were talking about its relevance on us having actually given this as a mandatory, then there's a different story. Number two, I would wish that you don't really quote the minister selectively as you wish on the issue of the vaccination of children with one jab of J&J because of a transient myocarditis that has been picked up in other parts of the world. He does not wake up with that idea. There's an advice. I think the best thing that we do have a government is that we have an advisor of team of professors, probably more learned than me and you, Kupe. I don't know. I would think you will also be invited to do that, but these are well-renowned scientists. About Professor Abdul Karim Slim, about Professor Mahdi, about Professor Mlisan, and Professor Glenda Gray, and about Professor Cale Becker. These are eminent professors in the world. I mean, we need to make our mark for you to be picked up and be part of that team anyway. So we are not really, as government, think we know it all. We are supported by an eminent group of eminent South Africans and other internationalists who are well learned on research. And if you therefore have a challenge with that, then let's actually agree that you do have a challenge because your view as Dr. Kupe, as Dr. Dhlomo, is much more superior to that of those that are advising us as government. Number three, let us not actually conflict issues. Professor Mahdi is just one of the team players. It's just that sometimes Professor Mahdi chooses to be a part of the team player, or he chooses to give his own views. But in any event, it's not something new in medicine to say, what's the second opinion, what's another opinion? So he gives one of his opinions, and therefore we don't go and tap on the opinions of the collective. And therefore, you cannot therefore say to us as government, why don't you stick with what Professor Mahdi is saying when there's other 10 professors who are having a different voice than his? So where do you expect us to go? We would choose to go with where we have listened to in the majority, because it's his choice sometimes. When he wants to, he's part of the team. When he doesn't want to, he can do a solo interview and brings his views, but his views is just one of many views. And we are therefore guided by a collective of views as a government. But again, despite the misgivings that some of the South Africans may have, to date, we have vaccinated over 348,000 children between 12 and 17. Their parents are happy. They are not forced. Some of them have been asking us. We lost some children of 13-year-old, 15-year-old in Chatsworth in Durban. And the parents were saying, look, if we had started this vaccine, my child would not have died. He said, look, we can't. We have not been given approval. There's still a finalization of the registration of this for children. We will only do it thereafter. And we took a responsible position. As soon as SAPRA was saying they have registered it, then we gave it for those parents. Of 348,000 children in the country have done so. We know of other people who have taken the government to court on the issue of vaccination of children, and the court has said this thing is not urgent. Bring it as a normal case to court, not as an urgent application, and that's how the matter was thrown out at this for now. Because what we are trying to save lives. Now, I don't want to talk about the ivermectin because we are now going to conflate issues. As a chairperson of the portfolio committee, former, I would receive so many members of parliament talk about ivermectin, and that is true. Eventually, SAPRA says, it's your choice, Dr. Dhlomo, if you want to use ivermectin to your patients, but we will not register it as yet, and it has not been registered as for human consumption. What dosage, how often? I need to motivate for my patients, if I have to give them that ivermectin, and say how much I give, but it's not registered yet in that category. So I don't know, because we are now going to talk about vaccines, and we are going to compare what did you say about ivermectin. I don't want to get into that debate, and that is not what actually my invitation was all about. All I'm saying is that we'll continue as government, and we are happy that there's over 26 million South Africans who are to date vaccinated, and that's how we are going to go along. As of more and more to be vaccinated. That's the issue that we out and the issue about what Minister Nkosazana has said with the process that she was on, that space also is not something that I would comment on for now. I would actually, but I could, all I can say that there is information that is incorrect. That is, I mean, it's very simplistic to say you actually prepare in the event this happens, because you already know that this happens elsewhere. It's very simplistic to take it that way, but anyway, I'll leave it at that for you.
Okay, thank you, Honourable Deputy Minister. Just to clarify it or to simplify it to the viewers who are watching the program now, the vaccines, according to our government, are approved. They are not clinical trials. Am I right, Dr. Dhlomo? Did I hear you clearly?
Did I hear you clearly?
Yes, they have been approved for use.
They are approved by SAPRA.
Yes, ma'am.
And that I want to re-emphasize, the Honourable Deputy Minister, you blessed viewer at home there, is saying that the stand of government is that COVID-19 vaccines are not mandatory. That is what he's saying to us. And I'm coming to you, Dr. Kathrada. Can we hear your closing comments?
Certainly. I just want to make 2 points of clarity. Firstly, Dr. Kupe, you were 100% correct regarding ivermectin, but it was my group as well. So it was ACDP, AfriForum, a group of pharmacists called Pharma Value, and my group of doctors called I Can Make a Difference. We took SAPRA to court to unban ivermectin. So that is 100% correct. But on the point of that, ivermectin was approved under special record, which is Section 21 approval, which means that we have to apply for on a per patient basis unless we get it from a compounding pharmacy. And that is where my second point of clarity comes in, when the Honourable Minister said that SAPRA has approved the vaccinations is also approved under Section 21. My question would be then, why are we not filling in a form that takes 1 hour to fill in every time we vaccinate an individual? We will not get into that because it is time for closing comments. And you did also mention about the side effects. My concern is on the same day that SAHPRA is now inviting all healthcare workers to come and take a second shot of Johnson & Johnson, when we were originally told it was a one-shot vaccine, they're now inviting them to come and get a booster because they know that vaccine efficacy does not last. And they only know that in retrospect because they did not wait the normal time for safety and efficacy because we are still in a trial. In 2023, the trials will be over and then we'll be able to collate the data and then tell you how effective and how safe the vaccines are. Because up until then, make no mistake, we are in a trial for all vaccines in the entire world. So on the same day that SAHPRA invited people to take the second dose of J&J, they also sent around a circular saying that they now know and they have acknowledged that there are side effects, ITTP, which is immune thrombotic thrombocytopenic purpura, and VIT, which is both thrombosis caused by the Johnson & Johnson vaccine. Two separate documents released on the same day, asking people to vaccinate and then telling people that we now know that there are side effects that are now emerging. Having said that, I am very grateful and honored to be part of this platform, because this is the kind of thing that we need to educate the public, because 100% what we are seeing, even in a forum like this, there are mixed messages. Because what is my understanding from what I am seeing with my patients and what I am seeing from my people who are begging me to say, my company is forcing me to take the vaccine. And when I say to them, show it to me in writing, they'll say, no, it's not in writing, but my boss said, if I don't take the vaccine, I can't come to work. If I can't come to work, I'm going to get fired. That is coercion. And that's the kind of things we need to address on forums like this, because when the government says one thing and then allows something else, we are in such trouble as South African people, especially since our constitution was built on democracy and freedom. And our constitution in this country, from anywhere in the world, was written to protect the people. So our liberty is never against challenge. And South African people need to know what their rights are, and they need to start engaging on forums like this. And if there's something going on with your workplace, or if you are not sure what the department said, I implore everybody out there, write to them, write to your employer, write to the Department of Health, write to SAHPRA, ask the questions. And I can tell you, I've done it. I still don't have a reply from SAHPRA. And the last point of clarity is, the Honourable Minister is incorrect. I am involved in the case that is taking the Department of Health and SAHPRA to court to stop the vaccinations immediately in the age group between 12 and 17. We were heard today by the DJP. Yes, you are correct, Minister. He did say it's not urgent, but in today's meeting, the DJP has said by Friday we will get a date. Our case was not thrown out of court. It's going to be heard by a panel of judges, not just a single judge. We are waiting to get a court date. So we are still very much in the fight. We are there to fight for the freedom of our children and the freedom for our rights. That's where I want to leave it at. And I thank you again for giving me this platform so that we can educate South Africans and tell them, you have rights. Know what your rights are. You can't fight for your rights if you don't know what your rights are.
Thank you very much, Dr. Kathrada, for coming to the show. We really appreciate your time and we appreciate your inputs. Thank you very much. And Dr. Kupe, over to you.
Thank you. I can do nothing else but echo Dr. Kathrada. I think we are saying the same thing, consistency of message. And again, as an attorney and as a lawyer, rights, hard fought for rights. The Constitution is the most supreme law of the land. It is the most, every other piece of legislation takes its strength from the Constitution. So we cannot afford in a democratic nation like this, Republic of South Africa, to have those hard fought, choices, freedom of choice, freedom of religion, all of those. We can't afford to have them pulled out from under the rug. Like I said, the government needs to be consistent in their message. If vaccines are not mandatory, then we can't have certain ministers making them mandatory. saying you cannot come unless you're vaccinated. That is imposing them on people. You're making it mandatory. So people need to be functioning under one policy, doing the same thing. You can't have somebody here doing something else, somebody else doing something else, all saying we're representing government. So I 100% agree. I also want to say the issue of natural immunity, we need to look at it more. People are talking about herd immunity, herd immunity. As Africa has not been impacted the same way as other nations in Europe, etc. Let's explore the issue of our own natural immunity. Africa can still build herd immunity while protecting people from mass vaccination. The Western world is not able to do that anymore. There are nations, some nations where they're doing up to 4 and 5 jabs. It's now 2 jabs, 3 jabs. Some nations are up to 4 jabs and 5 jabs. And what has not been told to people, as Dr. Cathadra has said, is that the efficacy of the jab is limited. And so it's not like you're going to have just 2 jabs. It's going to be every year. Every year you're going to be jabbed. So it's not like a one-time jab like when you're born and you have one-time jab. This is going to be a continuous jab. So we are just asking the government to be transparent in their information. We're asking them to be consistent in what they're saying, that all of them should be saying the same thing. If it's not mandatory, let them say out there it's not mandatory so people can understand. Department of Employment and Labor should say it's not mandatory. Ministry of Sports should also say it's not mandatory. All the ministries should be singing from the same hymn page. Thank you so much for hosting us, Mamuruti. It's been an honor, and like Dr. Cathadra said, very, very important discussion for South Africa.
Thank you very much, Dr. Kupe. I appreciate your being here, and we really need to talk to our people because there is a lot that is being said out there, and if we do not engage in these issues, we will have a serious problem in our nation. Right now, as you say, there are people who are saying we feel that it's like we are no longer living in a democratic country. Rights, as you say, you are a lawyer, you know it best. So being a lawyer and being able to talk to the people and talk to them about their rights is very important because, as you say, this is a hard fought for democracy, of course. And I'm going to give this time to the Honourable Deputy Minister to do his closing remarks. And I must say that, Honourable Minister, we appreciate your being here. And here are the people of South Africa listening to what our government is saying about these vaccinations, because people now feel that it's like they're being forced to vaccinate. So let us hear your closing remarks when you address the nation or when you address the listeners.
No, thank you very much. After this, I really have to go and rest my voice before really taking his talk. But let me start by saying I do appreciate the invite and the comments that have come up from the other presenters, because it looks like some work still needs to be done. But the starting is to say the government did not portray a picture that we know it all. This pandemic comes in with a very technical and scientific background that some of us as leaders in government will not have known to handle. And therefore, a decision was taken that there should be a ministerial advisory committee of scientists that will support this ministry in all what it does. And whatever we pronounce, we actually have workshopped it. There are almost weekly meetings of the minister or the deputy minister met by the professors of this ministerial advisory committee. So what we say in public actually has actually been workshopped, advised by the ministerial advisory committee. Let me give you an example. The committee are talking something that all of us agree on, that this issue of vaccines against COVID is a new thing. Nobody is actually having a wise and a wealth of knowledge on it. The advisors of the minister are saying the first batch of South Africans who were given a J&J are healthcare workers. No one yet in the world has given us an information as to when is this immunity going to wane from the bodies of, maybe the presenter here is correct. We get flu vaccines every year. So maybe for COVID-19, we're going to get jabs yearly. So the advice from the scientists was to say, if there is any group of South Africans who must be given a second dose or a booster, it must be those who came in first, and those were the healthcare workers. Hence is the reason we are giving the booster to the healthcare workers. It's not something we thought of yesterday. We want to hear advice, and those advice are coming in from scientists, and we follow that route. There's another advisory committee, Ministerial Advisory Committee of Civil Society. Among other people who are in these areas are trade unions and leaders of workers who listen to the discussions, who make their comments and make their inputs. And they're all saying, we have been out of work for too long. By the way, I don't know, it looks like some of the colleagues even have a challenge even with the lockdown. Maybe there's a discussion for another day. But some of the world leaders have commended our president for doing a lockdown on time. Of course, not everybody would have liked it, but the workers are saying, we don't want another lockdown. We want to comply with whatever it will take for us to continue business as normal. And therefore, we'll do and support these programs if they are meant to do just that. Now, on the other last part is to say, we would then be saying to the colleagues here, our guide is this science. And I'm not going to be speaking on behalf of SAPRA, but we are also very much aware of the hard work that they do. But just to give you this last part, vaccines in the country is not mandatory by government. We don't think there's a mixed messages there, because if I do it, I decide in my own private entity to do so, then that is not the responsibility of government. But the government, we are saying, we are not going to be getting into the space and oppose those who, for whatever reasons, are saying, in my space, I would ask and make all those who work with me, who stay with me, to be vaccinated. Now, this last part, I did mention, and we are not having it. It's maybe because I'm not a lawyer, but I used it. I said the matter was thrown out of court as an emergency, was an urgent matter, and it was asked to follow the normal process of really putting a case in court to be heard. I'm saying it was thrown out as an urgent matter. Yes, it is still there. It will follow. But the ACDP and all those who are working with them were actually applying in court to have the matter heard urgently. And the court says there's no urgency on this matter. Let it follow the normal process, which it is now following. We do have our own preparations as a department on that matter when it sits into court, and we will be able to argue our processes thereon. Thank you very much, and thanks for the invite, and thanks for the contribution that other colleagues did make on this matter.
Thank you very much, Honourable Deputy Minister Dr. Dhlomo. We appreciate your presence on the show, and given the fact that you are catching flu, and we hope that you recover your voice quickly, because I mean, talking with us here, you were straining your voice even more. But we really, really appreciate your coming. I must say that, Dr. Kupe, this topic, it still needs a lot of engagement, and we have been talking about this for quite some time now, because I believe that as leaders, we have got that responsibility to really avail information to the people that we lead, so that they get to gain understanding. And when they've got the understanding, they are able to do what is right for them. And we have availed this space for education and engagement. And blessed viewer, you have heard from our guests here the Honourable Deputy Minister, Dr. Dhlomo, talking to us, and we appreciate him very much. And he has given you whatever that he has given you now, the information that he has provided to you. And you have heard from Dr. Kupe, who is in the legal field, and you have also heard from Dr. Kathrada, who is in the medical field. And you were listening, and here I am saying to you that after you have heard what you have heard, you have the responsibility to make your decision on what to do. And this is what we are striving to do. We are striving to bring you information, looking at what is going on throughout the world and seeing the confusion that is reigning, because I still believe that there is confusion, really. And we would want people to be educated so that they receive knowledge. And thank you so much for tuning in. And what I'm going to say is that you have heard for yourself. You have heard for yourself, then you are empowered to go out there and be able to even educate others. And if other people want to listen to these discussions, they can go to YouTube, to the Pastor Mkuba Facebook page, and we are going to be broadcasting this even on other channels like your Tshwane TV, where we are broadcasting every day, 6 p.m. to 7 p.m. every night, and even 10 p.m. To 11 p.m. every night on Tshwane TV, and also How TV during the weekend, and also 1KZN, 8:30 Sunday evening, and also on Soweto TV. So we are going to be spreading this information. We have had many discussions, Dr. Kupe, regarding this topic. We have called even our health MECs from Gauteng province, and as well as Limpopo province, and also other virologists, so that they could engage with people. We really want our people to know what is going on. And blessed viewer, we are having another engagement on Wednesday evening, 6 p.m. We are going to be engaging with this topic of children who are falling pregnant. 9-year-olds and 10-year-olds falling pregnant in the Republic of South Africa, where we have got laws and courts. We want to understand what exactly is going on in our country, and we are going to be talking even with a spokesperson of SAPS, because we are so interested in hearing what are they doing after they have heard about these young children who are falling pregnant, because as far as I understand, that must be statutory rape, because those kids are just kids. We are going to be talking about this. We cannot just let things happen in our country and we keep quiet. And as a church station, we have to stand for justice, and we have to stand for the truth. Even what is being suppressed out there, we are going to engage with it. We are going to talk about it. And we are going to allow you to engage in these matters. And I've noted the comments that you were sending on WhatsApp and as well as on Facebook. They are available there. We're going to continue to read them and get to understand what you think about these matters. See you again Wednesday evening, 6 p.m. And God bless you. Stay well with the Lord. And from me tonight here, bye-bye. And also from the apostle, good night.